Welcome to the MS podcast series. Thank you for joining me. I'm Nicola Graham, and in this podcast, we're going to be looking at bladder issues, which are a very common and very concerning MS symptom. It's a symptom that causes, for quite a lot of people, a degree of embarrassment. And I guarantee you, by the end of this podcast, you're going to feel really comfortable. You're going to have received lots of great tips and strategies and some really good expert advice. So I really encourage you to stay listening if you are experiencing bladder issues. So I'm really delighted to introduce to you today Bridie Phillips. Bridie and I usually sit next to each other in the MS office, but we're having to do this remotely. So very warm welcome to you, Bridie. Thanks for joining me today.
Thanks, Nicola. I'm so glad I can talk to you a little bit about bladder dysfunction and MS and just give you some tips and strategies. The thing with bladder dysfunction is that most people find it really embarrassing, and it needn't be. And there's a lot of help out there, and you can improve your quality of life by simply speaking out about it. So what we often find with people when they're having a lot of bladder symptoms is this feeling of embarrassment, social isolation, self-esteem issues, and often finding that courage to actually speak up and accept, well, this is a normal bodily function. And it can have some huge impacts to our body and to our mental health if we don't do something about it.
Yeah, and that's fantastic, Bridie, because hopefully by the end of this podcast, people will really have some clear steps about what to do. So I'm going to get started with what I know is some of the most common questions that you get asked, and that I know our listeners are going to be really keen to know. So why do people with MS have bladder issues in the first place, Bridie?
Look, it's really quite simple. We're very complex as human beings, and we're very clever. So normally when we want to go and wee, our body tells us that our bladder's filling up, and there's messages shooting between the bladder muscle and the brain saying, hey, you need to go to the toilet. But in someone with MS, there's a bit of a dysfunction of the nervous pathway between the bladder and the brain and the spinal cord. So the messages don't get through really clearly. And it can also be related to where specific lesions are within the central nervous system, and that can actually impact that nervous pathway connection between the brain and the bladder. So it can cause all sorts of things that can go on.
So I know we're always telling our listeners that MS is different for everybody, but what are the typical bladder symptoms that somebody with MS might experience?
Okay, so we often hear about urgency, frequency, nocturia. So that means going to the toilet a lot at night. Incontinence. So, obviously losing control of when you go to the toilet and that leaking in between. Some people have changing in the flow or hesitancy, or sometimes even difficulty starting the stream. You might find that there's more urinary tract infections. Some people have failure to store the urine. And obviously that results in a bit of a leaking, urinary retention. So, an overflow or too much urine actually sitting in the bladder. And sometimes those very complex bladder muscles and the little sphincter muscles, which is the little muscles that control opening and closing the urethra to let the urine out. Sometimes there's not that coordination of nerve sequencing between those, and that can be part of the problem as well.
Thanks, Bridie. I think as well, it's really important for our listener to note that 10% of women who haven't had a baby and 30% of women who have had a baby have bladder incontinence. So it's quite a common symptom for many women, regardless of health condition. How common are bladder symptoms for people who've actually got MS, Bridie?
In actual fact, 90% of people with MS shows some degree of what we call voiding dysfunction. So voiding just basically means passing water, or incontinence, usually 6 to 8 years after the initial MS diagnosis. So look, it is really common, and it can be inconsistent too. So there may be other factors that are involved at a particular time, but we actually do find that the majority of people with MS will have some form of dysfunction at some time in their disease.
So, Bridie, can it vary over time? Or if you've got a certain bladder issue, will you always have that and you just have to learn how to manage it? Or can it sort of fade in and fade out?
It can be intermittent. So some people do actually struggle with quite significant bladder problems, but if you're sort of under a specialist or you've had some really good advice from a continence nurse, continence clinic, they can put some management into it. So the symptoms that you're experiencing might not be there all the time. And different things, like if you've got a urinary tract infection, obviously that's going to impact some of these symptoms as well. Or if you're having a particular other sort of illness, that can actually impact you generally as well. So it's really variant. And as I was saying before, it comes and goes, and people will experience different symptoms over different periods of time.
Okay, so it can be a change in picture, but it's pretty interesting to hear 90% of people with MS within that 6 to 8 year period actually show some degree of bladder dysfunction.
Yeah.
So so you're definitely not alone. So what are your top tips, Bridie, if you've got bladder issues? What do you do about it?
I always suggest, if you've noticed that you are having some problems with your bladder, I always recommend people go to the GP first, because we want to eliminate a urinary tract infection as a cause. One of the things that we've found with people with MS is that a lot of people do actually have what we call a silent urinary tract infection. So what that means is, traditionally, we're told if you've got a UTI, you've got burning, stinging, smelly wee, all of that sort of thing. Sometimes that doesn't always happen in someone with MS. And often when we find other symptoms developing acutely, just like stiffness, spasm, fatigue. Sometimes, we find that the body chemistry is a bit out of whack, and behavioural changes, and being a bit short-tempered, and just little things that happen. Often when you go and get tested, it sort of presents a bit like a pseudo-relapse. So you think something's not quite right, and often it is just a urinary tract infection that can be treated quite easily. And the other thing is, if you do have a urinary tract infection, we want it treated fairly quickly, because the bacteria can backflow to the kidneys, and you can end up with some more serious kidney dysfunction. And that's when you start to see sort of, your chemical imbalances and behavioural changes from altered blood chemistry as a result of that. So GP, number one, always speak to a medical professional. Now, sometimes it's really, really hard to get the courage to go up and talk about something that's really quite personal. But I encourage the listeners to remember, even the doctor has to go to the toilet and wee, even the queen wees, okay? And it's a really important bodily function that's completely normal, and you shouldn't have to deal with this stuff without getting some advice. So we actually have a continence nurse service, so you can ring MS Connect. Other medical professionals will do an investigation of the cause and get a proper management plan in place. Sometimes it's, surgical interventions might need non-surgical interventions. Sometimes it can be pharmaceuticals. So some medications can be really, really useful. And sometimes it's just around behavioural methods, positioning on toilet, bladder training, muscle training, pelvic floors, all sorts of things like that. So speak to someone and reach out for some advice. And it doesn't matter where you start with that. Keeping a diary is also a really good idea of input and output, putting in triggers to your changes in your bladder, your bladder habits, your time of toileting, how much you've had to drink that day, all of those sort of things. Really, really handy. And that also streamlines when you talk to a health professional, because you've got all the details of what's been going on in front of you. The other thing is, be prepared when you're going out and about. So always know where the toilet is and ensure that you do regular toilet stops. So normally we would pass urine sort of between 5 and 7 times a day is pretty normal, maybe once overnight. But if, you're going more frequently than that, we don't want you being anxious and worried about wetting yourself when you're out in public. So just note when you get to the shopping centre, where is the toilet? Or if you're going to a friend's place for dinner, check where the toilet is before you start, so that you're well aware. The other thing is to keep up your fluid intake. It's really important to maintain your hydration and kidney function. So some people will say, I'm not going to drink because I don't want to have to wee. But what happens is if you don't have enough fluid on board, the urine becomes quite thick, quite dark. You sort of get that dehydrated feeling in the bladder, and that can actually irritate the bladder and eventually lead into a urinary tract infection. And then what's actually happening is that you are going to the toilet more often. So it's kind of a vicious cycle. But the other trick with that is if you stop 2 hours before you go to bed and empty the bladder before you go to bed, it may actually help with that nighttime need to get up to go to the toilet as well.
And I think that's a really important message, Bridie, about people keeping hydrated, even though, like you say, they're tempted to not drink so they don't have an accident, but that keeping hydrated is so important. Also, we hear a lot about pelvic floor, especially for women. Can pelvic floor exercises help at all in this area?
Absolutely. So they've actually shown that significant results reduce incontinence. So that also includes, the amount of leakage, the number of leakages, the frequency, and the feelings of urgency as well. And also influences your confidence, and improves your quality of life. And the thing with pelvic floor exercises, there are specific physiotherapists that actually deal with pelvic floor. So you can source those out and get these exercises specifically for you. And the good thing about them, they're simple and they're non-time consuming, and you can do them at any time of the day with minimal effort. In fact, you can actually, do them at the traffic lights. You can do them while you're watching TV. There's so many places that you can actually do them.
That's the feedback we've had from clients as well, though, isn't it, Bridie? Is it's just remembering to do them. And we've heard some funny tips of people do their pelvic floor exercises every time they come to a red light. Yeah, I think I need to put a Post-it note on my steering wheel as well to remember.
Yeah, it'd be really funny if you looked inside someone's car, wouldn't it? You're looking and seeing what they're doing. But anyway.
Well, luckily you can't see when you're doing your pelvic floor. So, Bridie, I also want to ask you about catheters and where they fit in with bladder issues. Can you talk a little bit about that?
Yeah, look, there's lots of different catheters. So before we sort of go down the catheter pathway, it's really important that you get sort of a full assessment, because the management of your bladder symptoms is very dependent on what the underlying cause is. So are you holding too much urine? Do you have an overactive bladder? What is actually going on? But for those that are holding, so what we call retention. So if you're holding big volumes of urine after you've been to the toilet and it's actually you're not passing it, you're at risk of increased urinary tract infection, and of course your bladder fills up a bit quicker. So sometimes the doctor will actually, or the clinic will actually recommend that you do self-catheterization. So often that's a rigid tube and easy to manage. And so there's lots of instructions and support around how to do that. And it's not as invasive, I guess, as you think it might be. They're very, very discreet. They can be done in public toilets, and they teach you all the hygiene methods. And some people need to do that many times a day. Some people might need to do it just before they go to bed. There's also sorts of things like that. But then we've also got indwelling catheters and suprapubic catheters. So your indwelling catheter is probably for someone who is constantly wet and their bladder really isn't functioning very well. And so they might use an indwelling catheter, which is one that sort of goes up through the urethra into the bladder. And often that's how we start off. But if it becomes we can see that it's becoming a long-term need and it's going to be more permanent, a lot of people will move to the suprapubic catheter, and that's the one that goes through the abdomen straight into the bladder wall. And these days, they're so discreet. They're clamped off with a little clamp at the end. And, you can utilize them in a much better sense than many, many years ago, where they were attached to a bag the whole time and they were huge cumbersome tubes. So everything's a lot more discreet these days.
And obviously that's sort of on the more serious end of the spectrum for people with bladder issues, and there's a lot of other options on route as well. So Bridie, one of the options for people as well is looking at their lifestyle, what they eat, what they drink. What would your recommendation recommendations be to support a healthy bladder?
Okay. So we all know we should be drinking about 1.5 litres of fluid across the day. And when we're saying fluids, we're talking about sort of water-based fluids, things that hydrate the body and flush the kidneys through, and then we pass. So drinks like caffeine, soft drinks, energy drinks, alcohol, they all are diuretic type drinks, and they actually can lead to dehydration. So what I would say is you don't have to give up those things, but you've got to make sure that you're also putting a reasonable amount of water into your body to compensate for that as well. If you think spicy and acidic, those sort of things can actually be irritants to the bladder wall. So if you're drinking lots and lots of orange juice and things like that, it might actually stimulate the bladder wall and make you want to wee a bit more. We've talked about the bladder diaries already. The other thing that's really interesting is to avoid constipation. So often we find when you have urinary problems, you may have bowel problems as well. But what we do know is if you are constipated and your bowel is full, it's actually going to impact your bladder. So it's really, really important that we avoid that as well. Probiotics can be really good in keeping a really good normal flora happening through your urinary tract system. Cranberry, you'll hear a lot about. So cranberry is sort of a very natural berry, I guess, that's used as in juice. You can get it in capsule form. You can get it combined with urine, but they reckon that it's a natural way to stop bacteria adhering to the bladder wall. So a lot of people get onto cranberry juice. Exercise is really good, obviously, to keep all your muscles and circulation going up. And I guess a big part of this, in terms of a healthy lifestyle, is to speak up, because this really does help your mental health affects your physical health. And if you're finding that you are having some bladder symptoms and it's really impacting you emotionally, speak up, get some help. There's a lot out there.
That's great advice, Bridie. And can you talk us through what can happen in a typical bladder assessment?
Okay. Yeah, the bladder assessments are really great, and usually through a continence service. So referrals can come from many health professionals straight into the service. They're usually around 2 hours, and it can actually take a couple of sessions to get a full system. And why I really like these is that it's a really holistic approach to what's actually going on with your bladder. So they don't just go, okay, what's the problem? Okay, you can't empty your bladder properly. Well, okay, let's do this. What they actually do is they go into your surgical and medical history. They go into your dietary habits, your alcohol consumption. They get you to start the diary, which is why I was saying it's really good to get started. They might do a 24-hour urine collection to have a look at what sort of chemistry is actually happening in that urine. They look at your sleep. They look at your lifestyle. They look at your history of urinary tract infections. They look at the medications that you're on. And then they might do things like some ultrasounds for diagnostics, looking at your residual amounts, looking at your bladder pressure. And then at the end of when they've sort of got everything that they can possibly do, they'll sort of start to make up a bit of a management plan. And it might be that you need some further investigation. So they'll make a recommendation. Do you need to see a urologist? Do you need to see, maybe it's your bowels affected as well? Do you need to see a doctor that specializes in bowel medicine? All of these sort of things. So they look at absolutely everything and then come up with a plan. And then they can also advise around continence products, arranging NDIS, arranging my aged care support. So it's a really valuable experience. And if you do start to keep a bladder diary, so from now when you're planning to see a continence clinic, you've got all your information already. So you're sort of ahead of the line before you even start, if that makes sense.
Yeah, it sounds really comprehensive and well worth doing. If you've tried all of your suggestions to date and you're still struggling, are there any other supports available, Bridie?
Yeah, look, there is. So you go through your GP, you go through a continence nurse, and as I mentioned earlier, we do have a continence nurse service. So call MS Connect and ask a little bit about that, and they'll certainly direct you to the right area. you can speak to your neurologist. You can also get a referral to a urologist. But I really recommend, firstly, that full continence assessment and management plan. Sometimes it's as simple as prescription medications. And sometimes if they're used in the right context, you can get some really good therapeutic effects from those. There's continence clinics in public hospitals and some local communities. The National Continence Helpline is a free phone service and it is very good. And often they will give you advice as to where to go within your area as well. And the number for that can be online. Continence aids available, and have a look as to whether you can or you are eligible for government funding towards that, because we all know that continence aids can be quite expensive. So if you can get access to some funding for that, it's really good. The other thing is that a lot of these things, if you buy them in bulk, they're a lot cheaper and they can be delivered, so you don't have to go out and buy them all. There's a thing called a national toilet map, which is really, really good too. So if you're out traveling, you know where all the toilets are. If you're out and about, I always recommend people pop in their handbag or their carry bag, nappy wipes, nappy bags, a change of underwear, just in case, so that you've got that there so you're not so worried about it. And I guess my biggest message is that no one needs to struggle with bladder symptoms, and you shouldn't let these impact your quality of life. There's just a lot of help out there, and it doesn't happen overnight, but the biggest thing is that you need to speak up right from the word go and get some professional advice and get that management plan on the way.
Bridie, that is fantastic advice, and I really appreciate all your knowledge and wisdom that you've shared with myself and the listeners today. And I hope that anybody who's listening feels that there is something they can do that is going to make a significant difference for them, and that you're not alone grappling with these symptoms. There is support available. So thanks for listening today, and we'd love to hear from you. You can subscribe to the MS podcast. You can email us any topics you'd like covered, or you can send us feedback by emailing msconnect@ms.org.au, or we'd love to hear from you. Get in touch by calling MS Connect, which is the gateway to our services and to our continence nurse, as Bridie indicated. And that telephone number is free call 1800 042 138. Thanks for your company today, and we look forward to our next podcast. Bye for now.